This is Dr. Joni Watson. Welcome to the Handoff, the podcast for nurse leaders brought to you by Works, healthcare's flexible staffing platform. I'm thrilled to introduce our episode guest today, Dr. Brad Jordan. He's the CEO of a long-term acute care hospital in North Carolina. Brad's journey in healthcare began on the front lines as a paramedic and led him through a series of impactful positions, from system EMS director roles to academia, regional leadership, and ultimately to the executive suite as a CEO. With a solid academic foundation, Brad holds an associate degree in emergency medical science from Davidson County Community College, a BA from Laurel University, a Master of Health Administration from Pfeiffer University, and a doctorate in health administration from the Medical University of South Carolina. His professional credentials are equally impressive. He's a paramedic, a certified program planner, a fellow of the Advisory Board Company, a fellow of the American College of Health Data Management, and a member of the American College of Healthcare Executives. Brad's leadership is rooted in his practical experience and academic expertise. And today, he's here to share his approach to workforce management. We're excited to have him share and discuss his approach to workforce leadership, recruitment strategies, and engaging team members. Brad, welcome to the Handoff.
Thank you, Dr. Watson. I am equally thrilled to be here. Thank you.
Absolutely. Absolutely. Well, you are known for being a passionate leader who loves people and puts the workforce first, which I will just tell you right now, I'm totally biased towards that kind of a leadership style. I'm curious, Brad, how has this philosophy shaped your approach to leadership?
Thank you for that. So, I began my career in EMS, as you had stated. I practiced as an EMT, which is an emergency medical technician, and then became a paramedic. So it's always been about the people, like the person on the other end of that 911 call maybe needing assistance. Taking care of people is something that I have done my entire career. So I practiced as a paramedic. I was a program director of a local community college. And so I'm taking care of people as our students and prospective students. I was promoted to the dean of a community college. So I had a whole division that I'm taking care of. I was a system EMS director, a regional director of emergency and trauma services. I landed a role as a vice president over emergency services, and finally a hospital CEO position. I firmly believe that if we don't take care of our people, then how can they truly take care of our patients?
Yes.
It's important to me that, we ensure my team knows where I stand in regards to leading them into our vision. The workforce is hard. There's a lot of
Yes.
competition in the area, and especially here in North Carolina. And I need my team to know that I support them, and I am the leader that, the face of the organization, if you will, but I am there to support them.
Yeah.
I usually joke about my title as CEO. And I tell folks that it stands for Chief Experience Officer, and not Chief Executive Officer.
Yeah.
But I mean that.
Yes.
It's important to me to make sure our team knows how much but as well as the entire leadership team, appreciate their efforts, because again, it's a hard job. Healthcare is hard.
Yes.
Sometimes we treat them with food and snacks, and maybe it's the occasional ice cream, candies, and donuts. But
Yeah.
we do that because we care for them.
Yeah.
Putting people first. I recall a time when I was a system EMS director, and for the Christmas holiday, I had handwritten some letters, if you will, to the families of all of my EMTs and paramedics. And so when we addressed the letter, it was addressed to the family of, and then that team member's name and address. And that letter was a personal letter from me that thanked the family for supporting their family member that worked in EMS and offered some encouraging words. I
Wow.
remember, and it was so neat. Like, I don't know. I've always been that kind of leader that likes to handwrite notes and thank you
Yes.
cards and that kind of thing. I'm old school like that.
Yeah.
But I took this upon myself because EMS was and still is, I think, a hard profession.
Yeah,
I
absolutely.
remember, working in Florida, and I was the vice president over 7 emergency departments, and this was during
Oh,
the pandemic. And so COVID was there. It was exhausting for every one of us, including myself. And
yeah.
I had nearly 300 people that either directly or indirectly reported to me. And my family, my wife and my 3 kids, supported me in handwriting over 300 letters to every single team member's family, and I would address it the same to the family of, blank nurse or blank paramedic or blank CNA, and just shared with them my gratitude for sharing their loved one with us during this time of uncertainty because it was still 2020. We had no idea what was
Yeah.
going on. It was scary. And so, my kids to this day still joke about that and not really joke, but it's like, Dad, do you remember that? Like, we helped
Yes.
you write all those letters. I'm like, no, you didn't help me write them, but you definitely helped me stuff the letters and place the
Right.
stamps. But, it doesn't matter what role that I've been in or that the listeners may be in, but to take every day and try to uplift your team and let them know just how important they are to your mission.
Brad, there's so many beautiful pieces in that response. I love your perspective on being a chief experience officer because really, as part of leaders' role, I firmly believe that leaders curate the culture of their
Mm,
organization. And so, absolutely, we shape the experiences in big and small ways and with every single one of our decisions. I too am biased towards handwritten notes,
love
but
it.
I have never written to the family members. That is a great idea. I've heard of some other large companies doing that, but man, for people who don't write handwritten notes, it definitely is a labor of love. It's an
Mhm.
investment to write that many handwritten notes for sure, but it's powerful. And
Yeah.
even though it is quote unquote old school, I think it's actually a novel thing
Yeah,
these days because I don't know about you, but we don't get too many handwritten notes these days. And
absolutely.
Brad, I love that you involved your family in it, and I love that your children have that memory of stuffing envelopes and putting stamps on those because wow, what a powerful example. And we don't really talk about that a whole lot in leadership, how some of these leadership activities sort of meld into our home lives, but
Mhm.
they absolutely do. And so, I love that your kids have that memory. That's so beautiful.
Yeah,
So,
it was truly amazing, and the text messages and the pictures I received from the team, and they
oh,
would hang the letter on their Christmas tree, or it was on their mantle, or, they
ah,
they sent me recordings of their family reading it aloud to them. So it truly made my holiday, if you will. But it was,
yes.
again, that uncertainty. We didn't know what to expect. We had only really been in COVID for, since like February or March of that year. And so it
Yes.
was, it was tough. So
Yeah.
I will always cherish that and hope to continue doing stuff like that.
Those are great examples about putting people first and thinking broadly. So, Brad, how does this leadership model or philosophy, how does it extend into honesty and transparency that can lead to better engagement and retention among your staff? I mean, I can see, the ripple effects that some of this stuff that, some of these interventions and care will do. But I'm curious, how does this extend to honesty and transparency in caring and engaging your team members?
Sure. I think the quick answer is visibility. As a leader, I firmly believe no matter what your role is, you cannot lead from your office.
Yes.
You must be present with your teams. You must practice, intentional rounding, not only with your team, but, with our patients as well.
Yeah.
So on any given day for me, my calendar has a block of time dedicated to rounding. And it
Yeah.
doesn't say patient rounding or team member rounding, it's just rounding. And that may mean I'm rounding on a leader, I'm rounding on a patient and their family, I'm rounding with one of my frontline caregivers. It just means I'm out of this office and I am doing what I do best, and that's to build relationships and connect with my team.
Mm.
You know,
Yeah.
it's not scripted by no
Yeah.
means whatsoever. I never ask the same question. You know, it's just me and them. So it's an
Yeah.
opportunity for them to ask questions, an opportunity for me to just to say, you know, how are you doing? How's your day going? How are you adapting to, maybe this new process or this new system?
Wow.
If they've shared something with me in the past, maybe about their family or maybe different accomplishments, I may ask about their child, their spouse or partner, that accomplishment they had. And for me, I remember things like that. So it's easy for me to recall them. But for them, they're shocked that I remembered, hey, he
Yeah.
remembered that conversation about my kid getting drafted for this football team, or my child starting T-ball. And so I love that stuff.
Yeah.
One of the questions I always leave my direct reports and indirect reports when I'm meeting with them is that, what can I do for you today? Is there something or anything I can do for you today? Now, typically the response is, no, I'm good, I'm fine.
Yeah.
But if I notice that that caregiver is working extremely hard, they have a hard assignment that day, maybe I'm giving them a coupon to the cafe or to the Panera Bread downstairs, or
Yeah.
maybe I'm taking some chocolate to the floor and rounding and saying, "Hey, I see everyone's working hard today. Here's a bowl of chocolate. Get you something."
Right.
And so it's always nice for me, but I need to ensure that a, I'm present, B, that I'm transparent with them, and lastly, I'm honest. Like, they know where I stand.
Yes.
We have different meetings and such, and through my career, we've attended different meetings just like everyone
Yeah.
else has. But daily we have different meetings like safety huddles, and our departments have meetings. I go to those. I
Yeah.
don't sit in my office and let my team talk about safety and quality. No, I'm there with them because that's how important it is to me as their leader. But also, I want my leadership team to see how engaged I am in discussions around quality, patient safety, and just overall support for what's going on that given day. You
Yeah,
know,
I totally agree, Brad. It's, as C-suite leaders, I feel like so many of us know how important rounding is, but it's hard. It's difficult with so many different strategic initiatives to
mhm,
do. And I mean, I love that you've prioritized it and you've blocked it on your calendar. I mean, I know that sounds simple to a lot of people, but we
yeah,
can decide ahead of time what our priorities are and stick with it. So that's
that's right.
it. Yeah,
And it's
incredible.
not, I want to say I do it 5 days a week.
Sure.
I try my best, but
Yeah,
things are going to happen, right?
of
People
course.
are going to call, people are going to stop in the office, and it's going to change the trajectory of the day. But that's quite all right, because I know
Yes.
tomorrow that I'm going to do it again, and I'm going to make sure I'm out there on the floor. One of the great things I think about being in this role is my staff never see me dressed down, if you will.
Yeah.
And so sometimes I'll show up in a pair of scrubs and they're like, "What is our CEO doing? He's wearing a pair of scrubs to the office."
I
But
love
but they
it.
all they also know that when I'm wearing scrubs, it's because I'm on the floor, right? I'm in the
Yeah.
department. I'm putting on PPE and I'm going to visit that patient that's here with us, maybe on isolation precautions. I'm walking a staff member down to the cafeteria so they know how to find it, and I'm not just giving them all these directions. But they know that when I have those scrubs on, that my intent for that day is to spend as much time as possible in the hospital and not in my office.
That's a
So
great visual cue.
yeah, and I think that that transparency has led, to my current and my previous teams just feeling comfortable with me, which I absolutely love.
Yeah.
I remember, and I think we've all been there. I remember working as a frontline caregiver in a hospital years ago, and I knew my supervisor's name, but I couldn't tell you what they looked like. I never saw administration, and so for my team in my current role and previous roles to be able to sit down with me and just have a conversation is just something that I truly love to do, and deep down, I think they do too.
Yeah, I
Uh,
agree.
they'll pop in the office, and I think I always joke and say, "You're here for the candy, not me." But I do think that they obviously want some candy, but also they love that opportunity because it's just us, and they can
Yes.
be honest with me, and they know that there's no judgment. And if they are having an issue, or maybe there's a barrier that needs to be removed, I'm going to stop what I'm doing, and I'm going to get the necessary people involved, and we're going to see what we can do to remove that barrier, because I want them to know again that that's the honesty piece, that's the transparency piece, but that's who I am as a leader, and hopefully that will be picked up on by other leaders, and they will also start to act that way if they're not already doing it.
Yeah, absolutely. And a little candy never hurt anyone, Brad. I mean, to pop into your leader's office and grab like some candy, take a breath and, ask about their day or even share an issue in a comfortable environment. I mean,
Mhm.
that those are clear cues about what the culture is like in an organization, and it's powerful. And the visual cue of wearing scrubs, I think, again, so many times we tend to discount these quote unquote simple or easy interventions, but
Mhm.
as clinicians who are in leadership roles, I mean, scrubs are like the original power suits. I mean, it really is. When you wear a pair of scrubs, I mean, people will tell you things that they won't tell
Yeah.
you otherwise. It just
Yeah.
changes things. So I love that you do that and you remind your team members sort of your past, present, and future.
This podcast is sponsored by Works, healthcare's flexible staffing platform. Whether you're looking to optimize open shift recruitment, internally manage your contingent labor, or build your own gig workforce program, the Works platform will help you create a more flexible, resilient workforce.
That leads me to our next question, because you do have a background as a paramedic, and I love when C suite leaders are clinicians. I really do think that they have different perspectives in lots of beautifully diverse ways. Not to say
Mm.
that non clinicians in the C suites don't, because I appreciate their perspectives as well. But as we're caring for people, patients, and team members, clinicians tend to have a little bit different perspective. And so, with your background as a paramedic, Brad, and your unique hands on approach in leadership, I'm curious, how does your clinical experience influence your leadership style and the patient care that sort of ripples from your leadership?
Yeah, so, being a paramedic was the absolute job that allowed me to learn how to be a leader. And people would think, well, you're a clinician, you're a pre-hospital provider. Yeah, but being a paramedic in rural North Carolina,
Yeah.
you are partnered with someone who they may also be a paramedic, but more than likely their scope of practice is not as expanded as yours. So they may be an EMT or an advanced EMT. And, with those different scopes of practices, the paramedic is ultimately in charge of patient care. In charge of the unit. I'm in charge of my partner. Whatever treatment plan that we decide is all on my shoulders as the paramedic. So you learn quickly in the field how to be a leader.
Yeah.
I think back to being dispatched to maybe a motor vehicle accident with multiple patients, or maybe dispatched to an event with multiple patients. As that paramedic, as soon as I arrived, I had to do a full, scope of the scene. What's going on? I had to delegate tasks to my partner. I had to work collaboratively with the local fire department, maybe it's law enforcement, to determine what our next steps were. And that made me mean requesting some additional resources, maybe performing some interventions on scene, or maybe even what hospital they should go to. So that decisions, or those decisions as a paramedic, were always made in the best interest of the patient.
Yeah.
Right? It didn't matter if I knew a hospital was 5 minutes down the road. If that patient needed a
Yeah.
cardiac center or a trauma center, and it was 45 minutes or an hour away, then
Yeah.
we were going to try to take that route based on my assessment and my clinical judgment that this patient would be okay with
Sure.
me until we got to that facility. So, this allowed me to learn how to lead people.
Yes.
It always, if I made the decisions to put the patient and people first, I knew I would always be supported, right?
Right.
I've used this in every role that I've been in. So in my current role, I don't practice as a paramedic, obviously, here in
Yeah.
the hospital, but that knowledge that I gained, that skill set that I have, has allowed me to have some really meaningful conversations with our providers, with specialists, our care team, with our nurses, our CNAs, our respiratory therapists, because as they have or meet barriers, or if we're having those conversations about a patient and maybe those next steps, yes, I know my knowledge is that of a paramedic and it's more pre-hospital medicine, but I was trained, right? I went to school. I
Right.
have proven that I'm capable by a skill set and by taking a licensure exam. And so that has helped me. But, you know, uh, when we get involved, sometimes we have to jump in and help in terms of the decision making process, not necessarily as a clinician, but I'm there as a clinician at heart, don't get me wrong, but
Right.
sometimes we step in, but also sometimes we take that huge step back and we let the leadership team do what they do each day.
Yes. Yeah. That's great, Brad. So, as you obviously have a clinician forward mindset as an executive leader, I know that you take care of the interprofessional team these
Mhm.
days. I mean, you are in a healthcare setting that has lots of different professionals and healthcare team members. So, what key pieces are you focusing on right now as you develop nurses and other healthcare leaders, both inside and outside of the hospital walls?
I am a first generation college student like many people.
Yeah.
And, my parents worked in textiles. I never dreamed that college would be an option for me, if I'm being honest.
Yeah.
I was an okay student in high school, if I'm being transparent with you and the listeners. I didn't really put in 100%.
Sure.
But it wasn't until after high school that I realized that I could really make a difference in the lives of people. But I knew I could not do it alone. It made me then think of what is my career going to look like. And I thought, what, let me go back to school and earn my CNA. So I earned my CNA uh, license,
Love
if you
that.
will, right when I was 18. And, as I grew in my career, I had amazing mentors that guided me in my career path and also my educational journey, if you will.
Yeah.
So, to answer your question, I think mentoring healthcare leaders by encouraging them to focus on their education, to focus on board certifications, because we know that sets them apart from a lot of other leaders,
Yeah.
to have that membership in maybe local and state and national organizations. And then lastly, some volunteering. I always make sure they know that I may not be the best mentor for you, and that's quite
Sure.
all right. But if I'm not, I'm going to try to help you find somebody that is. And so,
Yeah.
they should try to find a mentor that matches their character, their dreams, but most importantly, a mentor that will help them, through their journey to excellence or success in their mind.
Yeah.
As a member of the American College of Healthcare Executives, and I am a fellow of the American College of Health Data Management. If it wasn't for mentors for me years ago, I probably wouldn't have even thought twice about joining these organizations, because
Mhm.
again, you don't know what you don't know. But
Yep.
those mentors of mine helped to educate me and support me. So over my career, I have encouraged several people to obtain their undergraduate degrees, their graduate degrees, some doctoral degrees. And I also I do some adjunct professor and some teaching for Purdue Global, and
Nice.
so this contracted instruction time allows me to also impact those earning their degrees in healthcare administration. So that's a huge, just an amazing feeling knowing that you help someone accomplish a goal, whether inside the hospital or out.
Yeah.
And, the network that's opened for me for my previous students and current students, but also the network that I'm providing to them. So now when they say, I'm trying to get started in healthcare and, I'm really good at finance and I have an undergraduate degree in finance. What do I do? And so I'm able to have that conversation and go through different organizations that maybe are in their area or maybe organizations that allow remote work. And so what can I help you with? And so for me, it's really helping others to be successful, whatever path that may mean for them, because I know that without a doubt I wouldn't be where I am today without the help and support of my mentors.
Mhm. I wholeheartedly agree, and I think, any leader can probably attest to the same of having somebody in their life who saw something that they had for potential to spur them on, and so to give back to others and spur them on. I mean, you're clearly a people person, Brad. It's clear that you love people and you put the workforce first, not only in your current role, but also through adjunct teaching and, ancillary mentoring and support. That's beautiful. And so, on the handoff, we focus heavily on the nursing workforce, but nursing doesn't work in a vacuum. And you've kind of touched on this a little bit. Clearly, you think about nurses and the entire interprofessional team. How can we support nurses through focusing on the entire healthcare workforce?
Sure. So the nursing workforce, I don't say that's just registered nurses, right? The nursing
Hmm.
workforce is our registered nurses, our licensed practical nurses, our
Yes.
CNAs. They are crucial, so
Yes.
crucial in caring for patients. So, as a workforce, I believe that we have to adapt to what is needed for our patients. So, I read about things on Becker's and other avenues that say a lot of healthcare organizations are really focusing on nursing recruitment and retention. Some
Yeah.
are focusing on retention by performing stay interviews, and some focus on retention of other specialties like CNAs, housekeeping,
Hmm.
case management, and beyond. I remember, working for that health system in Indiana one time or working for a health system in Indiana. And when I started there, they referred to every employee as a caregiver. And I
Yeah.
thought, what an amazing concept. And so I loved that and I still use it to this day. So no matter what your role, so whether you work in admissions, case management, nursing, or administration, you are a caregiver. Your role matters to the care that is being provided to our patients, and we can't forget that. I
That
believe when we approach every caregiver, now with that I mean every discipline with this mentality, every member of the team sees just how valuable they are to the care being provided. So they may not be that, in quotation marks, clinician, by training or licensure, but they are caring for the patients daily, and we can't forget that. And
I love that.
yeah, and I want to go back to what you said about me being a people person. I truly am a people person, and I know we've all taken those surveys and stuff and those talent cards that
Yeah.
tell us where we land. And my top strength on my talent card is individualizer,
Yeah.
and which falls under the people acumen. So that means that relationships are most important to me, and I'm a good listener. And I personalize my relationships by proactive learning what is important to those folks that I lead. And so, just wanted to share that. So I truly am a people person, love people, and do what I can each and every day to help support them.
Oh, that's great, Brad. And I appreciate the perspective of talking about all team members as caregivers. I've never worked in an organization that did that. I'm going to adopt that. I love that because as much as we say that in healthcare, like in special meetings, I mean, our words are important. What we call our team members, our associates, it matters, right? And
Hmm.
so I love that every person on the team is a caregiver because they are. I mean, they're shaping
Absolutely.
the care. Yeah, that's beautiful. Brad, we've unpacked quite a bit about people centric leadership and putting the workforce first, a clinician forward leadership style. I'm always curious, what makes a leader and how they're shaped. You gave us a little bit of insight into that, but what are you doing these days? What are you reading or learning about to spur your thinking or nourish your soul? Do you have any great recommendations? And no worries if not.
Yeah, so for me, it's the soul. This has nothing to do with healthcare leadership whatsoever. But for me, I enjoy traveling with my family to learn about new places.
Yeah.
We visited states across the US, the Bahamas. We've been to Alaska and Hawaii, but soon my wife and I will be visiting Italy, Greece, and Turkey in the next few
Ooh.
weeks. And super excited. We'll be celebrating our 20th wedding anniversary and just
Ah,
us two, just touring the world, if you will. But my goal is to travel around the world and people watch. Don't judge me.
yeah.
We all do it. Uh,
Absolutely.
I like to learn about healthcare in other places and how
Yeah.
healthcare is transformed, especially in my local area, but as well as across the globe. It's amazing to me to see, old hospital buildings and then just to learn the history of what used to be there and how care has truly changed over the years and how our mindset is completely different.
Yeah.
But in regards to professionally, I am an audiobook guy. I love getting in the
Same.
car, turning on the audiobook, and then just driving to my destination. So, I like to listen to good books on, maybe being a good leader, how to be a great father, a great husband. But recently, I had a business development leader that reported to me, and she was promoted within our company, which is outstanding. And she has a desire to become a CEO, and one day she'll get there. But I was reminded of a book that was given to me some years ago, and it was called How to Become CEO by Jeffrey Fox. And because she was being promoted to a C-suite level position, I thought, you know what? Let me dust the cover off of that book. Let me reread that book myself. And so I reread that book and reminded myself of, those rules, if you will, that Mr. Fox
Yes.
put into place about rising to the top. And then obviously I passed it along and I was happily shared it with her. But yeah, so for me, it's I love being involved in my children's lives. And so whether that's taking them and watching them in dance classes or, watching them play in baseball. And, my oldest son will be 18 in a few months. So watching him grow
Uh,
into a young man and so it's just it's all about family for me. That's what I spend the most of my time doing. And then my
yeah.
free time, I feel like I'm grading papers for Purdue, but that's okay too because I love it. I love the impact that I'm able to have on people, whether it's in my full time capacity or my adjunct.
Yeah, that's great, Brad. I mean, we're holistic beings, so all of those pieces, no doubt, intertwine into the way that you lead and what you do. I mean, there's great evidence to show that people
Hmm.
who travel are, creative individuals and produce more ideas right after their vacation. So I think, yeah, go ahead, enjoy Greece and Italy and Turkey. That sounds amazing. So,
Yeah.
well, Brad, ultimately, what would you like to hand off to nurse leaders at all levels and in every setting today?
Never stop learning. I think that we have to push ourselves. We have to learn how to be comfortable in uncomfortable situations. And, if that means taking that extra course in Excel because you need to strengthen that, or maybe taking that extra course in conflict management, or maybe learn how to just be better at public speaking, do something that helps you learn and grow both personally and professionally. I think, when I finished my doctoral studies back in 2018, I said, "Oh, I'm done with school. I don't want to go back to school." Now I had a great experience at school, but after that, I thought I've got to do something. So I
Yeah.
picked up the guitar and, I
Oh,
started to practice. And I used to learn, or I used to know how to read music. I played the piano as a child. And so to be able to read music as a guitar player is a little bit different than that
yeah.
on a piano, but it's something I did. My family and I love being outside and outdoors. And so we're really big into ATVs and side by sides.
Yeah.
And so, for that, I had to learn about that, but I had to put
Yes.
myself in that uncomfortable situation to learn what it was like so we could have fun.
Yeah.
But yeah, so just never stop learning. Continuing education is so important. And so, whatever you can do, just embrace yourself in that.
That's great guidance, Brad. So, Brad, you've got quite the experience and background, incredible ideas. Where can people follow or connect with you to find more of your work and continue conversations?
Yeah, I'd love to connect with the listeners. I am on LinkedIn, so you can search for me there, Brad Jordan, and I'd be happy to connect with you and maybe schedule some Zoom calls and just get to know each other and pick each other's brains, if you will, and learn about what you're doing in healthcare, what I'm doing in healthcare, and how maybe we can partner together.
Excellent. Everyone, be sure to find Dr. Brad Jordan on LinkedIn. Brad, thank you for sharing your time, energy, expertise, and passion with us today. I love the way that you love and care for people. So thank you for joining us on the handoff.
Thank you, Dr. Watson. To practice, and I used to learn, or I used to know how to read music. I played the piano as a child, and so to be able to read music as a guitar player is a little bit different than that
Yeah.
on a piano, but it's something I did. My family and I love being outside and outdoors, and so we're really big into ATVs and side by sides.
Yeah.
And so, for that, I had to learn about that, but I had to put
Yes.
myself in that uncomfortable situation to learn what it was like so we could have fun.
Yeah.
But yeah, so just never stop learning. Continuing education is so important. And so, whatever you can do, just embrace yourself in that.
That's great guidance, Brad. So, Brad, you've got quite the experience and background, incredible ideas. Where can people follow or connect with you to find more of your work and continue conversations?
Yeah, I'd love to connect with the listeners. I am on LinkedIn, so you can search for me there, Brad Jordan, and I'd be happy to connect with you and maybe schedule some Zoom calls and just get to know each other and pick each other's brains, if you will, and learn about what you're doing in healthcare, what I'm doing in healthcare, and how maybe we can partner together.
Excellent. Everyone, be sure to find Dr. Brad Jordan on LinkedIn. Brad, thank you for sharing your time, energy, expertise, and passion with us today. I love the way that you love and care for people. So thank you for joining us on the handoff.
Thank you, Dr. Watson.